Imagine being a healthy teenager who suddenly develops persistent pain around the knee. At first, seems like a sports injury, but what if that pain is actually caused by an aggressive bone cancer? Welcome to Cool Medicine. Today, we will explore osteosarcoma, the most common primary malignant bone tumor, and learn its causes, symptoms, diagnosis, treatment, and prognosis. Osteosarcoma is the most common primary cancer of the lung. It develops when malignant cells begin producing abnormal osteoid, which is immature bone tissue. The disease mainly affects adolescents and young adults, especially during periods of rapid growth. However, it can also occur in older patients, particularly those with certain risk factors. Osteosarcoma is known for its aggressive behavior and its ability to spread to distant organs if not treated promptly. The exact cause of osteosarcoma is not always known, but several risk factors have been identified. Rapid bone growth during adolescence is strongly associated with the disease. This may explain why many patients are diagnosed during their teenage years. Previous exposure to radiation therapy can also increase risk. Additionally, inherited genetic mutations, especially in the RB1 and TP53 genes, significantly raise the likelihood of developing osteosarcoma. Osteosarcoma usually develops in the metaphysis, which is the rapidly growing region near the ends of long bones. The most common locations include the distal femur, near the knee, the proximal tibia, also near the knee, the proximal humerus, near the shoulder. In fact, around half of all osteosarcomas occur around the knee joint. The most common symptom is progressive bone pain. Initially, the pain may come and go, often worsening at night or during physical activity. As the tumor grows, the pain becomes more persistent. Patients may also develop swelling around the affected bone and reduced movement of nearby joints. In some cases, the weakened bone fractures with minimal trauma. This is known as a pathological fracture. Diagnosis begins with imaging studies. On X-ray, osteosarcoma often produces a characteristic sunburst pattern caused by new bone formation. Another classic finding is the Codman triangle, which appears when the tumor lifts the periosteum away from the bone. MRI is then used to determine the local extent of the tumor and to help surgeons plan treatment. However, a definitive diagnosis requires a biopsy, where tissue is examined under a microscope. Modern treatment involves a combination of chemotherapy and surgery. Most patients first receive neoadjuvant chemotherapy. This helps shrink the tumor and destroy microscopic cancer cells. Next comes surgery. Whenever possible, surgeons perform limb sparing procedures to remove the tumor while preserving the affected limb. After surgery, adjuvant chemotherapy is given to eliminate any remaining cancer cells and reduce the risk of recurrence. The prognosis of osteosarcoma depends largely on whether the cancer has spread at the time of diagnosis. For patients with localized disease, the 5-year survival rate is approximately 60 to 75% with modern treatment. However, if the cancer has already spread, especially to the lungs, a 5-year survival rate drops significantly, often to around 20 to 40%, depending on the extent of metastasis and response to therapy. The lungs are the most common site of metastatic spread. Thanks to advances in chemotherapy and limb-sparing surgery, survival rates today are far better than they were several decades ago. Early diagnosis remains one of the most important factors influencing survival and long-term outcomes.